most everyone were expecting. I mean, just to say again, welcome again. We're here last week. Good to see a lot of familiar faces again. And just to thank you again for making time to attend. So this is kind of the third workshop on value maps. The first was the launch session. The one last week was on segmenting spend. And this one is on defining and measuring inputs, outputs, and outcomes. Kind of as we set out, this is trying to help work through each of the bits of the value maps process to build up to a final complete kind of product. Luckily, we've got two excellent guests today from the ONS, really experts in this field. We've got Alison Spence from the Public Service Productivity Division, and Helen Pattison as well to kind of field questions. So I'll kind of probably close it there, hand it over quickly, and just to say, we'll have kind of 20-25 minutes of presentation, and then we'll open it up for discussion. I think this is one session again where the discussion will be probably the most kind of relevant part to kind of really try and apply this and get some practical things out of here. So I'll hand it over to you, Alison.
Thank you for coming and for inviting us to talk. What I'm going to cover today is some of the key concepts, some of the measurement issues, and try and put some examples in there to kind of show how they would apply. There is quite a lot to cover, and it's not all as simple as it sounds on a first inspection. But so just to say from the start, there's an introduction. We're kind of not expecting you to go away and be able to immediately apply all of this and measure everything perfectly by the end of the day. So the slides will be sent around for a reference, and we're here to help later on as well. So you might be familiar with bits of this and perhaps not all, but just to say that there's a lot going on in the field of productivity and efficiency at the moment, and there's kind of political agendas and as well as on data measurement side. So there's a lot of exercises going on, and they might all have slightly different goals, but we do all use the same sorts of terms, so I think it's really important that we start being consistent in how we use them, and that will help not only in understanding but in also making sure that we don't end up in a kind of data proliferation exercise. This is about making use of what data is available, not about collecting more and more. So why the interest at the moment? I mean, on the political side, of course we all know resources are being tightened and the need is not necessarily diminishing alongside that. So how do we best meet need within a tightened resource? And I think just generally in the policy environment, there's more of a recognition now about the value of data and the amount of data that we collect. And then for us on the ONS side, we've been measuring public service productivity for quite a long time, but we know that our measures can be improved, and we're being pushed to improve them from various places, including the Bean review of ONS economic statistics that's ongoing at the moment. So some of you might be familiar with this kind of logic model approach or a production process model, but this kind of sets out what it is that we're trying to measure and some of the basics. So the point of these is to try and to help show the relationships from that need that you've identified, so the reason that you're setting up a policy or project in the first place, through to your resource that you've got to address it, what you buy with that resource, what happens, the activities that are undertaken with that resource, through to your outputs, so what you produce or deliver, and then what you actually aim to achieve at the end of it. So I'm going to go through some of these later, but just a couple of quick points. One is about targets. So targets can be set for different parts of this model, and there's no kind of one way is best. It's very much on a case-by-case basis. So we're not going to talk much about targets, but just to put that in mind. And also just to kind of point out that it sounds fairly simple to flow through that model, but actually it's quite difficult to apply in practice. And there's some kind of blurred boundaries between some of those categories that we'll talk about. So before I go through each of them in turn, I just thought I'd put up a couple of examples to just kind of show how you might start to think about these different terms. So looking at apprenticeships, for example, you've got a need there about might be the number of people who are not in education or training or employment. So you've got some money, you spend it on staff, on funding for businesses, on equipment, on course materials, and then the output that you want at the end is a trained apprentice. The number of hours spent in training and the number of lessons, that's not the output, that's the activity that you undertake to complete it. So if you look at something like a traffic example, you might have activities around promoting a particular policy or a particular move towards different modes of transport, and your outcomes might be really varied from for the individual to kind of improve their health through to, for the country as a whole, reducing the amount of CO2 emissions, those sorts of issues. So it covers quite a range of things. I just put this up there at the start to say not to worry too much about this. It is quite difficult to see how these can apply in some programmes, and we're not expecting as part of value maps to have the answer at the end of this initial work on value maps. But there is a lot of data out there, and I think the costings exercises, if you're familiar with them, they've really shown that you can get some really interesting insights just by looking at the information that you've got in a slightly different way. So this is what the exercise is about, really. So you will get some insights at the end of it, and you'll also get ideas about where you need to improve measurement and where you need to improve understanding. So, to go through them each in a bit more detail, the spend, as Cody said, has already been covered, so I'm not going to talk about that. So just to talk about the inputs. So for all of the departments, it's likely that you will split your inputs into 3 categories, and there might be subcategories within them, but you've got your labour, so you've got your staff, and then you've got what used to be called intermediate consumption, and I'm not quite sure what the term is at the moment, but that includes everything from kind of general supplies that you buy, from the chairs that are being sat onto pens and paper and food in a canteen, all those sorts of things, to much more specific supplies that would depend on the programme area, so that could be anything from bullets to bandages in a hospital. It's really everything that you buy that gets used up in the process of producing your output that year. And then you've got your capital, so your depreciation of buildings and vehicles, all those sorts of things. And the key for us in terms of measurement of inputs is that what we're looking for is a quantity measure, not just an amount of spend. We're looking for the volume of inputs that have been purchased. We'd still need the spending data, because that is used to kind of weight together. So you want a measure of total input, you need a way to weight together the staff, the intermediate consumption and the capital, and that's done with cost data. So you're likely to have plenty of MI about those sorts of things to look at to start with. So once you've got those outputs, you move on to the activities, and it's really what do you do with those inputs, or what do those inputs do? And these tend to be measured more in terms of number of hours. So if you think of a service like the police, you might have the number of hours spent on patrol, the number of hours spent delivering safety talks in schools, for example. Or you could look at, so for something like education, rather than number of hours, you might look at the number of activities delivered, so the number of lessons delivered. Now, activities do quite often get muddled with outputs, and in fact ONS use activity measures sometimes to proxy outputs, but as much as possible you would want to split them up, at least on your thinking. So one way to think about the distinction between activities and outputs is about what you would buy from the private sector. So if I decided to pack in work and go back to university, what I would pay for is essentially the qualification. That is the output that I would be paying for. I wouldn't be paying for the number of hours I sat in electrical, it's that quality, it's that qualification. So essentially that's what we're trying to capture when we capture outputs. And again, it's like the inputs, we're looking for a volume measure, so it might be the number of people who are now cycling to work. It might be the number of children who've been educated. It might be the number of prisoners who've been both punished and rehabilitated. It might be, in a sort of environment sense, it might be something like the number of people now living in insulated homes. Or it could, for something like health, could be the number of patients who have been treated. And that's kind of where the difficulty comes in, because it's fairly simple to count the number of operations or the number of GP appointments, but actually measuring what a sort of a treated person is quite a different thing. So what we do in ONS is we look at patient numbers, but then we adjust it for quality using healthy life years. So they are difficult to measure, but you can get to those measurements if you look at them in detail. And finally, on to outcomes. So essentially looking at what did you set out to achieve, what was your objective, and that might be at a department level or a more specific programme level objectives. And essentially, why did you bother putting a policy or programme in the place in the first place? And the outcomes can be really, really far-ranging, both in terms of whether they're outcomes for the individual service user. So for the health service, that might be them having better health, or whether it's for the economy or society as a whole. For the health service, if you think of something like a vaccination programme, you've got outcomes for the individual in terms of not getting that disease, but you've also got the kind of herd protection that people talk about, so it's an outcome for society as a whole. And also in terms of if people aren't getting that disease, and you've got less impact on GDP, so people are more likely to be able to go into work. It's not going to cost the health service so much. So they're quite far-ranging. And then you've also got an issue in terms of how long it might take before you actually see that outcome. So for the prison service, just because someone's left, if you could think of them as a sort of treated prisoner, it's a whole lifetime that you'd want to look at the outcomes in terms of whether they're able to get back into society and contribute and earn a living. And it might even be that you're looking generations in time, so you're looking at whether you can break family cycles in terms of offending. So they can be really wide-ranging and long-lasting, which all makes them very, very difficult to measure. But you may well be able to get some data at least, either from surveys, from existing national statistics, or from your own evaluations that you fund. And I luckily don't have to go into the details about how you measure them so much. It's going to be covered by Mike in a few weeks' time in one of the workshops. And he'll be talking about how do you look at your outcome and actually try and separate out the impact that you or your policy has had on it compared to the impact of other services or of just general things that are happening. So if we look at something like health, it's also got the social care services are all going to have impacts on the same outcomes, and then there'll be just general things, climate change, anything, all sorts of things that are outside of our control can affect those outcomes. So how do you kind of unpick the impact that you've had? So I'm not going to go through this slide in detail, but it will be sent round to you, but it's just to make the point that you will have data about for all these different categories, but it's just to kind of pause and think about whether the data that you have is any good. Not all data is good data. So, do go away and look within the department, look within the official statistics system, or with your arm's length bodies, for example, and see what data is available. And these are kind of questions that you can have a quick look through to see what sort of quality the data is that you've got, because that will really have an impact on what you can and can't do with it. And again, ask your friendly statisticians or researchers or economists, and they'll be able to help with all these sorts of issues. But as I said, you will have data available on all these different things, and it's not the case that you need perfect data for all the different categories to give you anything useful. So even if you've just got information on spend and inputs, then you can have a look at your unit costs of inputs, and that can provide you some useful information. Or if you've just got information on inputs and outputs, you can look at your productivity. So you really can get some interesting information out, even if you've not kind of covered the whole process from start to finish. And in terms of kind of what they actually tell you, any of those measures aren't going to tell you anything in themselves. So if you find out that you've got an input cost of 1,000, that doesn't really mean anything. What you need to look at is how a comparisons over time. So that might be within your programme, how do the unit costs change over time? Or it might be comparing between different local authorities, different service providers, different regions, for example. So there's some examples of this up on the Civil Service Learning website, and there's a link that will go out with the slides, so it's good to have a look at those examples. So for example, the slide at the bottom is about adult social care, and it's mapping total spend in different local authorities to the number of people in receipt of services. So if you can see, for example, around 10,000 recipients, you've got one local authority that's double the amount of total spend from another. So what that would help you is to go, okay, well those are two local authorities I want to look at in a lot of detail and try and understand whether is that difference because the people that the expensive LA is delivering a service to just have more complicated needs, or is it that the local authority that's spending half is doing something really innovative that's really improving their efficiency, and it's a message, a best practice example that could be spread out over local authorities. So they do help you kind of focus your resource on what areas to look at in more detail to get some insights into your efficiency and productivity. So, just to go through quickly some of the challenges that might come up, and there quite possibly will be many. Some of them we can answer. So the guidance gives some of the answers to some of these in terms of your central costs, so the costs of things like HR, how do you count these? Will they get portioned out to your programme area but based on your expenditure shares? And payments by results should be treated just like any other service, they shouldn't be treated differently. Direct payments and transfers is quite an interesting one. So for us at ONS, we wouldn't count something like transfers, social transfers, or direct payments in our productivity measures because they kind of go out of the public service into household accounts and they're treated in that section. But for the purpose of value maps, you'd want to capture as much as possible of these things. So you can count the number of direct payments that have been made and the number of people who've been kind of treated by them, and you can have a look at the outcomes that those direct payments have had. In terms of outsourced services, again, for the purpose of value maps, you will have, contractors will have data, and it's about gathering as much in as you possibly can so you can populate the value maps and start to look at the different relationships and the different performance between providers. And there's the other questions, I suppose, are more tricky, and they kind of have to be dealt with on a much case-by-case basis. So, in terms of healthcare, we think we've got an okay measure of the number of treated units because we do that adjustment in terms of life expectancy and quality of life. For education, we adjust the number of students by GCSE attainment, and that's a measure of kind of how educated an output you've got, but could be improved certainly. But then you've got even trickier ones like how do you measure the outputs of a collective service like defence, and and the issue of how do you measure your impact on outcomes compared to everyone else's, which the later workshop will look at. So these are some of the types of questions that you might have. And so we're going to open the floor for discussion in just a minute, and we will try and answer them, or at least go away and have a think about them, and we can come back and talk to you more individually to try and help. So we are here to kind of help with some of these issues. We've got quite a long history of looking at them with some varied success, but we have at least got that good background knowledge. And then you've got Treasury here to help on the value map side and the further workshops, and we are kind of having a think about whether we need to pull together guidance on all these things to produce a new handbook on the different measures and how you'd go about kind of measuring efficiency and productivity. And yeah, would welcome any views on sort of what would be useful for that. Okay, so that's the end of me talking. So yeah, any questions or comments, we're happy to discuss.
I think just before we go to discussion, probably just worth kind of, again, bringing this back into how does this fit into the value maps overall process and what we're trying to do. Essentially, you know, as we said last week, that's about understanding your spend and how to segment it. This is very much, once you've got your spend, you've got your programs and your objectives, looking at the kind of evidence assessment grids, looking at working through the production process for each of your programs, and for each of them understanding your inputs, outputs, and outcomes, the data you have on each of those, and then your understanding of efficiency from that. So I think that's kind of where this fits in, and Alison, thank you for that good tour. So I think, you know, again, have that in mind in terms of how does this fit in, you know, where does this play into the work. It's about really having a really good understanding of that production process and thinking through it in that kind of systematic way across your spend. So maybe, yeah, any questions on what Alison said, or questions about how do I actually do this for my programs and areas of spend, any potentially areas where you can see you're going to have difficulty with this. I would say definitely use ONSs, and we've got a few of the pilot departments around the table here today as well, who we can hopefully kind of chip in or work through that as useful.
So I suppose just one thing. So in your production process, you did break out activities, which I think we don't currently do in the main guidance, but it feels like that's probably quite a useful thing to do from the experience I've had so far, which is, as you said, a lot of trickiness in definitions, and thinking like our example on plant health, where actually a lot of things sort of, there's a lot of discussion we had about what's an activity and what's an output. So it feels like that's actually quite a useful distinction to be making and sort of potentially incorporating in future guidance. But I think it's probably something we'll do going forward as well.
Yeah, I think the activities and outputs thing is one of those cases. So for us, we don't tend to talk about activities because what we want to measure in our productivity estimates is outputs. But like you say, I think until you look at them side by side, you just don't get the distinction. So yeah, I guess
it helps clarify some things.
Yeah, I agree.
Yeah, I was working on adult social care, which is an area where nearly everything is commissioned, and in two ways really, because the department commissions it to local authorities, and the local authorities commissions it from outside. So in that kind of context, I imagine looking at inputs is going to be less realistic than for other services. So you know how much you spend, but what's bought with that money is maybe a bit of a gap, and then you kind of get to outputs where you kind of, you know, what's been done. Is that just the world as it is?
I mean, I think absolutely that's the case. The more steps you've got between the people sat with the money and the people who eventually go and deliver the service, then the more complicated it is to kind of look at all those things. Because you've got, but the people eventually delivering the service, they will have data, and your commissioners in local authorities will have data. How good it is another question, but they will have some data, and then sort of moving backwards. So I think there is use in having an exercise just to look at what's available out there and then think about where are the gaps and where would it be good to get more data. Can you build that into commissioning models so that you've got more information on which to judge whether the service is really delivering as effectively as it could.
But I think it might be useful to have a chat with you afterwards or set something up, because it's an area which we planning to do a lot more work on in the ONS, and it might be useful just to join resources a wee
really
bit.
Fantastic.
Yeah.
Because I know we've had the last few weeks we've had a lot of issues around the direct payments.
Oh yes. Yeah, and I was the one who brought it up and said, where are they? So yeah, okay, let's chat afterwards.
I would say the other way we've kind of dealt with this in some of the value maps is that it may be that you don't have the data, but you're okay with that because your commissioning process is very effective at driving economy. So you've got competition built into your commissioning process, and so therefore, yes, it would be good to have the data, but in this case, you are sufficiently happy that you're driving economy through the kind of levers that you do have. Now, I'm not saying that's ideal, but it may be, you know, again, it's this trade-off between having excellent data versus being content that you have levers in place to ensure efficiency is being maximized or improved.
I think this is a good example of back to those different agendas going on. So that might be a sufficient good use of information, but it might otherwise be that you want to know, is adult social care delivering the best outcomes that it can, and that's going to require a very different look at data than a kind of, is our commissioning process question would require. So it's kind of getting at what's your most immediate question and can those be answered by what's available at the moment. It's not easy.
No, and I think it's more of the space we're in seems to be less about the quality and more about delivering the required service at the lowest cost, to be honest.
Can I ask something about the outcomes you mentioned? What struck me about some of those outcomes were they weren't quite the outcomes I was expecting. For instance, when it came to crime, there was a reduction in the fear of crime rather than a reduction in crime. And there was something also about affordable energy, and as outcomes they seem a bit more subjective, more difficult to measure than kind of your standard. A reduction in crime you can measure through statistics, but a fear of crime is more of a subjective thing. When it comes to our outcomes, are we expected to follow that sort of route or?
I probably say, I mean, in terms of what was actually listed as examples,
yeah.
It's purely down to space.
Okay.
So I certainly would expect you to have those in parallel, actually. So I would expect you to think about reduction in crime,
Yeah.
but also fear of crime, cost of crime to the economy, all those sorts of things. So I think it's about having a kind of basket of outcome measures that you look at and see how they interact.
For the value map, I would add that generally what your department looks at, so your business planning or your internal reporting, that's generally good enough in terms of that's what you're trying to measure right now and what you're trying to improve. And that's quite interesting across departments. I mean, some departments have really, really tricky outcome measures that are kind of global almost, and so they are difficult to measure, and it's kind of whether you want to have a slightly more direct, a shorter term, clearer how your service can have an impact, that sort of measure, and whether there's any value in also sort of supplementing that with those wider ones to kind of have a look at overall impact.
I guess I just had a few comments drawing on what people have said. So we found that kind of distinction between activities and outputs very useful as well, because when we started the conversations, there are people putting things in different places.
Yeah.
So we've kind of had to deliberately have that conversation to make sure we're clear. I think I've had some conversations with probably Sophie or someone in the team around for us defining police outputs and some of the challenges we have around defining outputs for our services. And we also have challenges around effectiveness. So a lot of what we do, so around immigration enforcement, protecting the borders, and visas and immigration all kind of contribute
Mhm.
to similar outcomes.
Yeah.
So detangling
Yeah.
that to being challenging for us.
I think to do those slightly separately. I think the activity and outputs thing, I think what has tended to happen in the past is we kind of try to jump to the measurement issue, and actually, and then that's where the blurring happens, because we know what we want to measure as an output, but we often can't do it, so we start using activities as proxy. And I think if you jump to that without doing the first step of actually trying to think of it and distinguish those things, so it's kind of treating them as two separate exercises about definitions and then about measures, and it's at the measurement stage where you accept that you're going to sort of proxy one with the other. So I think that's quite useful. On the outcomes side, so the multiple services having the impact on the same outcomes, and I think that's going to happen in quite a lot of departments. I think for me there's two things. One is about thinking about what evidence you do need, and if you do need good evidence on it, then speaking to your researchers and evaluators and seeing what can be done. But I think in the sort of shorter term and easier fix is to think about, is essentially just to be honest about it. And some of the departments do this really, really nicely. They say, we've got this outcome, it's really covers a whole of the society, it could be impacted by many different things, but we still think there's value in showing the direction of it. So fear of crime, is it going up or down? We still think there's value in showing that, even if it's not us that can kind of immediately impact on it. So yeah, it's just about being kind of transparent about what those outcomes show and what they can and can't be used for.
But that's what we've been saying, but we just find out we keep saying that for everyone.
Yeah. Have a caveat for all of your outcomes rather than each.
All these factors,
Yeah.
other factors affect everything.
Yeah, I think that's where triangulation can be quite useful though. So if you're seeing several activities doing the same thing, or several outputs moving in the same direction, or several measures of outcomes moving in the same direction, that might help to reinforce that you think actually, what we're doing here is having some impact. But besides that, yeah, it can come down to the kind of appetite and demand for doing more sophisticated analysis. And building that more into the policy design process. So that's probably more the next steps side of things.
Yeah, I think that the value maps will provide a really great starting point to start and look at these issues. And you can think about, in terms of the resources within the departments or within ONS, what things would be most beneficial to look at. So it is kind of a first step in a longer process to build up your evidence base.
What would you suggest to do in a context in which outcomes are delivered in a spending area, in a specific sector, and then they're measured in a different sector? For example, like I'm from health, most of our objectives in our SDP are about shifting care from the hospital sector to the community sector. And the idea is that the outcomes will be delivered in the primary care sector and the social care sector, and all the inputs and the activities that will deliver those outcomes will be measured there. But then the actual outcome is measured in the acute sector through, ambulatory care settings, through admissions, usually unnecessary admissions and stuff like that.
Yeah, I think there's a really interesting point about what level should these things be looked at, and it might be that in terms of outcomes, you don't look at it at a programme level, you look at it at a much higher level, because it just doesn't make sense to kind of disaggregate it in that way. But it's a really interesting one, and again, I think we'd be happy to have a chat about that and have a think about different ways you could look at it.
At what point would you adjust for additionality? Would it be at the outputs as well as the outcomes, or would it just be the outputs?
Outcomes. Your outputs, as much as possible, should be things that you can control, and the outcomes are the things that are a bit without, they've got the external factors. So. And again, there might be some blurring of that. additionality should hopefully be an outcome issue. Although I should say though, again, the service issue comes in there because there is some outputs that depend on other services, so it's not always clear cut. And again, it's thinking about the level of disaggregation.
Final questions? Did anything not make sense in terms of the overall structure, other than the activities point, which I think is a good one?
Or any sort of further guidance that you think would be welcome?
It's really, would people find the handbook Alison mentioned useful?
Yes, definitely.
Is this something we could start to work on?
Yeah.
Definitely.
You know, I think Lisa is a very tricky issue, and it would be good to have, I think, just more detailed conversations if possible about what we're coming up with. And
Yeah.
I think that's probably the most useful thing that we could do.
Please do, and I think on the slides Alison's email will
Yeah.
be there, so
Yeah.
do email
Great.
Alison. And we've got a team of about 8 of us at the moment,
Okay.
but we are going up in numbers hopefully pretty quickly.
Mm.
Okay.
So we're more than happy to help out.
And I guess just to explain ONS's role in this a bit more, we do produce estimates of public service productivity, but we're also got some expertise in terms of measurements and data that we can, offer to you as a service to kind of help you improve your measures. And it's a reciprocal thing, because if you get better data, then our productivity measures improve because we're getting better data from you. So yeah, do get in touch.
I guess just one more comment on the value maps thing. So, depending on how we split, depending on how we segment spend, then we have kind of these evidence assessment grids for each block. So I think that picks up on your point around, for some areas, the level of disaggregation in the value map will be easier, will be kind of maybe more amenable to this framework, and some might be more challenging in terms of defining each input-output economy. So for some, if you really kind of drill down to a higher level of disaggregation, it will be easier to map these out.
Yeah.
And for others, like we are kind of high level in terms of our value map, the way we split things, it might be harder, or vice versa. Yeah, until we really get into it, then the problems will become.
Yeah, I think as a first step anyway, it's thinking about what's most helpful for your area. And I don't think that's going to be one size fits all. I think it'll be a bit more flexible. I'm saying that, I'm hoping Treasury agree.
Yeah, I think you've just got to be pragmatic. There's no point looking at a very low, very granular service level if really what you're interested in is the outputs or the outcomes overall. So for police, probably you do need to look at police overall maybe rather than sub levels. But I'm just guessing. But
we are doing it very
I would come back to it's got to work for you and be be at a level that is generates useful insights.
And certainly we've got discussions ongoing about crime at the moment, because we split out police, the courts, prisons, probation, but is that the most useful measure? Is it not a sort of criminal justice system as a whole, because they are so intertwined? So the conversations continue. We've been tackling them for quite some time and still haven't got to a kind of perfect answer.
But presumably there's also a bit of a trade-off in terms of the granularity. Because the more granular you go, with more detailed conversation you can have around your inputs and your outputs and sort of economy questions, those kinds of things are much more robust when you're talking about specific processes. But when you go down to that level, it's harder to then have a conversation around outputs and outcomes and effectiveness. So it's, what level, where would you like to focus efforts? Is it around understanding economy and productivity? Is it more potentially about the effectiveness? And that probably also helps guide what level of granularity you start with.
Definitely. I think it comes back to this technical versus allocative efficiency question of, are you interested in the efficiency of the service or the program, or are you interested in the efficiency of the system as a whole and its component parts? So again, just being pragmatic, and you may need to do both to get to the allocative efficiency question. Excellent.
Well, I think we'll probably wrap it up there if there's no other questions. Again, thank you again, Allison and Helen, for your input today. And we will send around the slides. We've also been recording it, so it'll be available to you later as well to rewatch to your heart's content. And I would again definitely recommend getting in touch with obviously myself or Dan for value map questions, or on anything you've heard today, inputs, outputs, outcomes, activities. Allison has got her email on the slides, and we'll recirculate it. But this is an open resource to try and help nail these tricky questions. And then just to plug our next few workshops, we've got one on the 1st of March. Again, it'll be here. It's on improving economy. So we've got some people from the costing unit coming to talk about how do you improve economy and kind of productivity and kind of best practice in that. And then on the 17th, we're going to be talking about improving and understanding effectiveness, so questions of additionality and how do you actually link outputs to outcomes, what's good enough, and different approaches. And that one will be here at Treasury as well. And then we've got a final one on the peer review session, what that would look like and how to prepare for that. So again, thank you for coming today. Thank you, Allison and Helen again, and please do get in touch.
Thank you.
Thanks.